Good morning, dear students, and thank you for listening in on this short presentation of this very exciting course. So my name is Christian Kjær Petersen, and I'm Associate Professor in this department. I'm very sad that I cannot be here for presenting this myself, but I was lucky to get some funding just a while ago, and I have to attend to some meetings in order to obtain the last bit of funding for this. So I hope that this presentation here will be exciting for you. And overall, what this course will do is that we would like to actually develop your sort of entrepreneurship, if you will. So the overall theme in this course is that we would like to promote ideas and how we sort of get to money, because many of you guys will be sitting in this classroom right now with a lot of good ideas and a lot of good ideas for how to actually earn money. The little bit problematic issue when you're in sort of health tech is that when you have these good ideas, that's of course very good, of course. But before we can start earning money on this, there's normally requirements that you somehow test your devices. And this is of course because we are within the medical field, and if we want to apply something to humans, for example, there's actually regulations for how to do so. And when we can then do that, then hopefully we can actually start earning some money. The issue is that it's not that simple. We still need the good ideas. We still need to be able to somehow assess our good ideas and if they're feasible and if they're safe and if they actually have an effect. But there's actually also quite a lot of requirements for how we build these sort of devices, for example, or if we are talking about medical compounds or drugs, then there's actually quite a lot of requirements for how these are actually produced. And what we can then go through this huge line here, then hopefully we can start earning some money. At least that was my idea when I went into all of this. What I've realized and what is actually also the law, both in the States and in Europe and in Asia and actually all over the world, is that there's sort of quite a lot of demand on approvals. So first off, of course, we need to get our different trials approved. This is here in Denmark done by the Research Ethical Committee. Then there's huge requirements in terms of the Data Protection Agency, which I'm sure that you have heard a lot about in the last year. There's also approvals in relations to the Danish Medical Ministry. So getting all these trials and all these safety procedures approved is actually something that takes quite a lot of time. But if you plan ahead, you can do this quite easy. Of course, we also need approvals for how we develop our systems, how we develop our medical compounds. We need approvals for how to ship all of this and how we make sure that everything is actually in order when it leaves the factory before it gets to the end user or to the patient or to the clinician. To do all this, you might imagine that of course our goal is to earn money, but it's actually also quite important to sort of start getting some money into this, because this is not for free, and this takes up a lot of time, and throughout this process you will need some money. This is something we will not cover all that much during this course, but I think it's very important to note that fundraising, or at least somehow getting funding for these different tasks, is needed before you can complete this sort of process. It's also very important to know that when you have a good idea, then of course it's very good, and you should try to protect it. You can do that with a patent, but it's also quite important to understand when to actually patent something, because going through the patent process is not easy. It takes a long time. It's actually also quite costly if you're just by your own. And therefore it's important to understand when to patent something and also how to do it, of course. We will try to cover a little bit of that in this course as well. Of course, when you fundraise and when you do all these things and you come up with this magical plan for how to earn a lot of money, then you need people on board, and of course you need stakeholders. You need people who can actually pay a little bit for this. You also need most likely need a huge team, and at some time point people start asking you, can we actually make money of this? Because this is quite expensive. It will take you a lot of time. And will there actually be a benefit in the end? And a very good way to sort of try to establish this is actually by writing up a business plan. And a business plan focuses, of course, on what is the end goal. So when are we earning money? But of course, it also covers all these other processes. So how much time do the different processes take? How costly are they? Can we be more efficient? What happens if we do not stick to the plan, so to say? And so on and so forth. And we will try to cover that a little bit in this course as well. As I just briefly mentioned, it is very unlikely that you can do this by yourself because here are lots of processes. Here there's need for multiple different expertises, and therefore it's also quite important to try to sit down and get a sort of structure your team around both your idea but also the different phases of this testing. And to sort of set up your team, we will also try to have a short lecture on how this is done, or sort of like what is the organization within the healthcare system and how can you sort of use this to your advantage when you are going through these processes. So one might say that this sounds like a fantastic course. When you're taking this course, then of course you will know everything there is to know about health tech and how to get everything approved. That's easy peasy. And of course it's very important to understand here that this course will try to give you an overview of the different processes, but it's also very realistic to say that you will of course not understand all these things in depth, because this is a huge field. Within some of the processes I showed you just before, there are multiple thousand people hired for Novo Nordisk or for the big pharma companies and so on and so forth. So you'll scratch the surface here, you'll get an idea of where to go. Basically, we will try to teach you how to teach yourself so you know where to go and look. And we of course have a bunch of people who will teach this course. There's of course me. Now you can actually see my face. This is what it look like on a good day. I'm a biomedical engineer by background. I have a research interest within the pain sciences. I'm very interested in doing these things called pain profiling of patients with chronic pain. So I do these things to try to assess different mechanisms within the central nervous system, and I try to use this to understand if patients are in higher or in lower risk of developing either more chronic pain in the future or, for example, chronic pain after surgery. When we talk about industry, I've had some collaboration with a company called Notitech. I've actually been partly hired there, and what we wanted to do was actually to develop a system which you see here on the right hand side, which actually does a little bit of what my research interest is. So we try to develop a system that can actually make these pain profiles of patients. And we have gone through the entire process from idea to proof of concept studies to fundraising to actually getting it on the market. So I have a little bit of experience in how to develop research equipment, and I have a lot of experience in clinical testing and research sort of questions. And this is mainly what I will handle. I will handle the clinical testing, and I'll be discussing this with you through the first 5 lectures. Then we have Samuel Smith. Samuel Smith is also a biomedical engineer. He has a keen interest in understanding sort of the cardiovascular system in terms of research, and he has also been very involved in the industry. He actually has his own company called Acarix, who just launched a new device which can do some of the same thing as his research interests are. So it can actually sort of assess different cardiovascular problems in the system. So Samuel will of course be very good as well. We'll discussing sort of how to get from the idea to the market, because he's tried this. And in these sort of lectures that Samuel will give, he'll focus a little bit about the CE marketing and how to market, and how to obtain this, and what sort of this is needed before you can obtain it. Of course, we have Shelley. Shelley is also a biomedical engineer. She is from Canada, and all of her lectures will be conducted in English, which is of course what the common language would be here at the course, unless we only have Danish-speaking people. Shelley has a keen interest in pain mapping, and she tries to develop sort of methods on how these different sort of area of pain in chronic pain patients, what does that actually mean for the patients. She has a company which she's also started herself called Advanced Solutions, and they have launched this app, for example, called Navigate Pain. Shelley is again a very keen researcher, which is very much within the pain area, but she also has been through this process from idea to market. And what is very interesting with Shelley's sort of ideas is that she's actually developed an app, and apps are currently like the approvals needed for getting apps on the market is rising dramatically in these years, and there's multiple new initiatives actually making it a little bit difficult to get these apps on the market. And Shelley will know all about this because she's currently involved in all of those processes. So Shelley will of course discuss that a little bit, but she will also discuss reimbursement strategies. So that's how do you get money out of the system, so to say. And she will be discussing this with you. Then finally we have Ulrike. Ulrike you probably know because she's sitting in the classroom, I assume. She's of course your semester coordinator, but she's also teaching on this course. So Ulrike is also a biomedical engineer. She is very interested in how to model glucose control, and she's also been part of the industry working together with a company called Glucosafe, doing these sort of mathematical models of how the system work. And Ulrike will discuss project management with you and how to set up the correct team for your process, so to say. So I've not shown you the curriculum. Of course, you can go in and find that online. Everything should be on your Moodle page. But I try to show you what are we actually trying to teach you on this course. It's quite important to understand that this course is not mandatory. Something you can select if you think it's interesting. I do believe we have a really strong team for this course. I do believe it's quite important for people who actually want to go out and sort of develop devices or get into clinical research. So if you have any questions, you're of course more than welcome to contact me. My email is down here. I will be back in the office on Monday, so you're also more than welcome to stop by. But with this, I would like to thank you for your attention, and I hope you will have a very good day. Thank you.